Welcome to A&N In Depth, the podcast that helps you understand the inner workings of the Seventh Day Adventist Church. We are recording in St. Louis at the 62nd General Conference session, and I'm joined by my good friend, Costin Jordache. Costin, thank you for joining us.
Pleasure to be here with you, Sam.
Costin, we worked together at the General Conference for many years, and when you first started, we had a very special dinner in... Where was it?
Indianapolis.
Indianapolis.
Yeah.
No, it was in Europe somewhere.
Oh, way back then.
Yes,
oh, my goodness.
Way back. Anyway, since then, we've become good friends. We've collaborated in many different ways. But a few years ago, you left us and you went to work for Adventist
HealthCare.
HealthCare. So tell us about what you've been doing there and what impact your organization in particular is having.
Absolutely. Thank you, Sam. I did have the opportunity to transition, we'll use that word, transition from my role at the General Conference working with Adventist Review and, of course, with a lot of great partners in GC or General Conference communication to the Ministry of Healthcare. And I found it to be a wonderful transition into a different form of ministry. So Adventist HealthCare being the healthcare system that is located very close to the nation's capital and to the world headquarters, to the headquarters of the North American Seventh-day Adventist Church, offered me an opportunity to lead their brand development. In other words, what is Adventist HealthCare known for in our communities, and how do we develop that intentionally, recognizing our mission, the mission to extend God's care through the ministry of physical, mental, and spiritual healing. So our brand has to mirror that commitment in our mission. And then they've also asked me to lead the strategy portion of the company. In other words, the strategic planning function, so that we can understand what the future looks like for Adventist HealthCare. And over the next few years, over the next decade, where is the organization going? And once again, how can we be very intentional about those steps that we take?
Wonderful. Well, in this conversation, we're going to talk about Adventist healthcare systems. We have many around the world. In fact, as a network, we are the second largest faith-based healthcare network in the world. So this is a big deal. In North America, there are 5 systems. So we're going to try and understand how they work once and for all. And then we'll talk about some elements of connection with government funding and healthcare, and then we'll see what the future of healthcare is altogether. So if you're interested in that kind of thing, this is the conversation for you to be part of. So let's start with understanding these health systems. How does it work?
Fantastic. So there are 5 healthcare systems, believe it or not, independent of each other. 3 of them have very similar names, which from time to time causes individuals to think that one system is another system. I'll go through all 5 of them succinctly so that we can begin to understand the lay of the land, as it were, very tangibly so, geographically across the United States. I'll start with my healthcare system in the northeast part of the United States. Adventist HealthCare is headquartered in Maryland, and we serve essentially the communities of the District of Columbia, Maryland, and Virginia. We call that the DMV, the greater Washington, D.C. area. Then we move to Florida, where Advent Health is headquartered. So Adventist HealthCare in the Northeast, Advent Health, headquartered in Florida, and they have hospitals and sites of care throughout 9 states, starting in Florida and going all the way through to, I believe, Colorado is potentially the last state toward the western part. Now, we'll stay on the eastern part of the United States because we're going to Kettering Health next. Kettering Health is the 3rd healthcare system, and they are located in Ohio, and their hospitals are located in the state of Ohio. Let's move to the western part of the United States.
Okay, so let's revise so far so that we're not confused. We're talking about the east part of the United States, so this will be from New York to all the way to Florida in the south and D.C. in the middle. So you mentioned 3.
That's right.
Adventist HealthCare is in the D.C. area,
That's
Virginia,
right.
Maryland, D.C. Then you went to Advent Health, which is headquartered in Florida but goes through 9 states
right.
there. And then we went to Kettering Health, which is in the state of Ohio.
That's right. So far, so good. A+.
So far, so good. Okay, 2 more to go.
2 more
I can
to
do
go.
this.
2 more to go. Then we have Adventist Health. So it's Adventist HealthCare on the east, Adventist Health on the west coast. And they have hospitals in Oregon, Washington State, California, and Hawaii as well.
Okay.
And then we finish out with Loma Linda University Health. 5 independent healthcare systems, all affiliated with the Seventh Day Adventist Church. Interesting to note that the 4 healthcare systems outside of Loma Linda, right? So Adventist HealthCare, Kettering, Advent Health, and Adventist Health, are all affiliated with their unions. So in other words, the governance units that in the Seventh-day Adventist Church we call unions, multi-state.
Not the labor unions.
Not labor unions. No, these are governance units that are multi-state units of Seventh-day Adventist presence, right? So each of those 4 systems are affiliated with unions, and they are all chaired by the board of directors, the board of trustees are chaired by a union president. Loma Linda is an official entity of the General Conference or the World Church, and so they are normally chaired by a vice president of the global church, not of the union. So all of us affiliated with the Seventh-day Adventist Church, but all of us independent organizations working together.
Excellent. Now let me explain the structure of the church on this side so people understand how that works. A group of Adventist churches forms a conference. Sometimes a mission, but we'll just keep to the regular. So it forms a conference. And a group of conferences forms a union. And a group of unions form the General Conference that operates in the world through 13 divisions. One of them is the North American division. So within North America, there are a few unions, and those unions, they have the responsibility to create this integration and governance of the healthcare systems.
Absolutely, correct.
The only exception is Loma Linda, that serves a global purpose of setting up other health systems in different parts of the world.
Also has a school of medicine, school of dentistry, so they're set apart in that way as well, even though some of our other healthcare systems also have schools, right?
And the governance is set, the chair of their board is a General Conference vice president. I think Pastor Tom Lemon has done this for a while and presumably will continue as now he's being elected as a general vice president for another term.
Right.
Okay, so now we understand the governance and so on, but so let's go down a little bit more. How Adventist are the Adventist healthcare systems in North America?
Yeah, that's a great question, Sam. Before we get there, I think it's good for our listeners to understand the scope and scale of the 5 healthcare systems in the United States. So together, we intersect with about 22 million lives a year, 22 million lives every single year. That happens through about 2,700 sites of care. So a site of care can be anywhere from a hospital to a doctor's office. So about 2,700 sites of care across the entire United States. We are the second largest faith-based healthcare system collectively, if you were to put all 5 together in the United States. And on top of that, we employ close to 200,000 people, and we operate over 100 hospitals. So these are actual full-size hospitals, over 100 hospitals collectively across the United States. So what an amazing ministry and what an amazing opportunity for the Seventh-day Adventist Church through the ministry of healthcare to intersect with our communities, to serve our community members with healthcare that is so badly needed for all of us throughout our entire lifetime.
I often present Adventist healthcare, not the systems, but Adventist health altogether, as an anticipation of the new earth. So Seventh-day Adventists believe that one day God is coming back and he's going to recreate this world. God has not given up on the world, despite the suffering and the pain. He has not given up on us, and he will come back and he will restore this world. And when he does this recreation, we are told that disease will be no more, death will be no more. So Adventists anticipate that new earth and try to make it as much as possible reality in this very old earth, so that if no one will be sick on the new earth, what is it that we can do together that will alleviate the suffering of people today and help them to be healthy? Hence the preventative nature of Adventism. Let's try and avoid people going to hospitals altogether, only if they really need, and let's delay that as much as possible because we are healthy, not because we want to avoid going to the doctor. But That's the essence of it. Christ came and he did the same in his ministry, and all of our hospitals do the same, including those that are not Adventist and work in our hospitals.
So yeah, let's actually go back to the question that you asked me. How Adventist are our Adventist healthcare systems? We all, in one form or another, adopt the name Adventist somehow, whether in our name or whether in our mission statements or our values. So here's the great news. All 5 healthcare systems have mission statements, and all 5 of those mission statements and the descriptive paragraph under those mission statements make it abundantly clear that we see ourselves as the extension of God's care and the continuation of the healing ministry of Jesus. That is why we exist. And I think those of us who understand why companies, organizations have mission statements understand that is a statement of purpose and identity. This is why we exist. And those mission statements are guarded very, very carefully. Now, to your point, what we attempt to do every single day is to interpret how that mission statement then extends to the delivery of care and to the delivery of care models that each of our healthcare systems begin to employ. And all 5 of us, again, to one degree or another, because we all have our unique approaches, but all of us collectively try to deliver that holistic physical, mental, and spiritual care that we started out as Seventh-day Adventists over 150 years ago, pioneering and advancing and developing. And so our systems, our healthcare systems in the present day and age, continue to try to understand how to best create delivery of care models based on that Seventh-day Adventist whole person care approach.
There are many advantages to being large. Mm-hmm. There are the economies of scale kick in. You can secure more equipment for cheaper. Mm-hmm. There are many things that are advantageous in having large healthcare systems. But there are also risks that come alongside that. And one of the risks that people have identified is that governments want to bring healing to their own citizens in whatever way that is necessary. And so they would employ hospital systems that can deliver that in the best way possible. And there are many of your hospitals are actually government hospitals that you run, that I've been told in different ways that some hospitals, they've asked us to run the hospital because of the way that we run hospitals. So, and apart from that, there are many other ways in which the government provides healing to their citizens through Adventist healthcare systems, among others.
Sure.
And the concern is, if that is a substantial amount of money, will we compromise on our values? During the vaccine process, for example, there were many accusations of this. It's like you're taking so much money from the government that you have no interest in keeping your values. How is it that we can maintain our values despite the sometimes large investments from government funding to bring healing to their citizens? Can you navigate that for us a little bit?
Absolutely. That's a great question and a valid concern. The concern is actually much broader, and it has less to do with healthcare organizations and any organization that has a set of values that underscore its mission and its vision and its operations. So if you have misalignment of values, right, in any partnership, that causes concern because down the road it could actually have an impact on a mission-driven organization that later on could essentially take a different route than it had originally planned due to that partnership, right? So in healthcare, clearly, and in Seventh-day Adventist-based healthcare, we watch that very carefully, that misalignment. But let's talk about government funding for a second. First of all, government funding that flows into Seventh-day Adventist healthcare systems comes in at least 3 forms. I mean, there's, I'm sure, plenty more, but at least 3 major forms. The first one is through Medicare and Medicaid reimbursement. So patients that present who are either Medicare patients or Medicaid patients.
What is that?
Right.
Help us
Sure.
understand those systems, because it's an American government, federal government assistance. So how does that work?
So again, all of us pay taxes, right, in the United States, or we hope that all of us pay taxes in one way or another, right? And those taxes, in part, help to fund Medicare and Medicaid. Medicare is set aside for those who are of retirement age and beyond, who no longer have coverage by their companies that they worked for And so now they have a Medicare plan that the government funds through their own contribution. So in other words, I've been paying into Medicare since I was 18 years old, and when I retire, that's going to be there for me as well. So everyone kind of pays into this government pool, and then when we retire, Medicare pays. Those are government funds that flow into hospitals all over the United States, every single hospital.
So let's say a 72-year-old retiree goes to your to a hospital. They are covered by Medicare.
Medicare. Right.
And the treatment that they receive will then receive funding from the government, their contributions throughout the years that will help to cover that.
That's right. And their treatment will be equal in quality to those who have, let's say, commercial healthcare insurance that is offered by companies around the United States, right? Equal treatment, equal opportunity to provide or to receive just exceptional care. The second bucket there, Medicare, Medicaid. Medicaid is a program that recognizes that not everyone is going to be able to afford healthcare insurance throughout their lifetime, whatever hardships they might be facing. I mean, an innumerable a number of scenarios that lead to that. Folks who might be on disability, for instance, they are covered by what's called Medicaid. Once again, the federal government recognizes that there are individuals who require healthcare insurance so that the hospitals aren't left having to cover that uncovered care, right? And so once again, those are government funds that flow into hospitals across the entire nation, including all Seventh-day Adventist hospitals. As you can imagine, especially as Seventh-day Adventist hospitals and healthcare organizations, we will provide care to anyone who seeks it, much like Jesus modeled for us, that anyone seeking care. So we certainly don't distinguish between, that's government funding versus a commercial a provider, or should I say not a provider, but a payer, or we call them insurance companies. We don't distinguish between those at all. So.
What a blessing that we can, in the United States, have a government that will help to fund those that are coming to receive care, either the retired ones through Medicare and the ones who do not have a way to sponsor that themselves, so don't have insurance, Medicaid.
Correct.
So that's one form of
One form, and I think I want to go back to a point that you made earlier. So the government doesn't necessarily run hospitals. The only distinction is the Veterans Administration. So for veterans, the government... Military, right. But for everyone else, the government doesn't run hospitals, and they depend on nonprofit healthcare organizations, faith-based healthcare organizations like Seventh-day Adventist HealthCare systems to provide the care. So the government funding comes in the form of reimbursement for Medicare and Medicaid, but the government depends on us to be that amazing part. And what an honor it is for us to receive those patients as Seventh-day Adventist HealthCare systems with these amazing missions that are rooted in Scripture and rooted in the ministry of Jesus.
Yes.
Right? All right, so the second form is through research grants and other form of grants that sometimes fund innovative models of healthcare or delivery of care sort of options that may not be available, AI-based treatments, or should I say AI-enhanced delivery of care models. And once again, all 5 healthcare systems take those grant partnerships very seriously. We take a look at what possible misalignment of values there might be, right? We don't just say, wonderful, this large grant, let's just, use it and, it'll help contribute to our operations and drive innovation. We take a very close look at what that partnership will actually entail from a requirements or criteria perspective. So that's the
So
second
if something
point.
is demanded from our hospitals or systems, we would analyze that very carefully.
Correct.
And if there is a misalignment of value, what happens?
Well, that's when judgment and discernment comes in, and a system understands whether the risk is significant or whether the risk is minor, whether we can mitigate that risk, whether we can negotiate our way through it. I certainly can't speak for all 5 healthcare systems, would never even begin to imagine, but I can tell you that at Adventist HealthCare, we have a number of sort of ethics boards and committees, and we constantly analyze those potential points of misalignment.
And you have Seventh-day Adventists that are sitting in those boards that analyze those things.
Absolutely. At Adventist HealthCare, we even have an advisory group that is made up of senior leaders who are Seventh-day Adventists, who are constantly looking at the alignment between our healthcare system and we call it our sponsoring organization, the Seventh-day Adventist Church, right? And we are on a monthly basis meeting to analyze this area versus that area versus this opportunity versus another opportunity that may come up. Again, I would say on behalf of the 5 healthcare systems, I can say this, that all of us are very thoughtful and intentional about those type of partnerships, and they are very much considered, right? Very much considered.
So that's the research.
That's the research. The third part is in essentially expanding our mission by growing our footprint. Let's say you build another hospital, or you build you build an outpatient setting that may require, due to the lack of funding, may require a partnership with a county, like a local county in the United States, or even a city, or a state, for instance. And so we might approach that governance unit, whatever that might be, for partnership and funding, right? But again, those conversations are very carefully laid out and thought through, so that the Seventh-day Adventist, value-based, mission-driven systems don't end up in some form of partnership that somehow will create a significant misalignment with our values. And again, I can only speak for Adventist HealthCare, but I know in general, all 5 healthcare systems seek to have that type of intentionality when it comes to partnerships, and specifically when it comes to government funding.
Thank you very much, Costin. I hope that clarifies a lot of people's questions about that. Let's talk about, for the last few minutes, the future of healthcare. So we've been noticing that healthcare systems, universities, hospitals, and so on, are moving toward a holistic healthcare. So over the last, 30, 40 years, you could go to a hospital and they will see your knee doctor. Right. And then if you wanted to see a heart doctor, cardiologist, that would be another department altogether. And you could have problems with both, and the medicine of one is interfering with the other because there is a hyper-specialization of medical care. Right. That is changing. We find many universities now talking about holistic care, understanding the whole person, which is something Adventism has been doing for 150 years. Ever since our first sanitarium is what we used to call it, our first few hospitals and care facilities. How do you see this now that you've been for a few years in this medical environment, this connection between what the world is discovering and going toward and what we've been doing so far already?
Yeah. Well, first of all, I would say that the future of healthcare within the Seventh-day Adventist Church is certainly going to build off of the past and even the recent past. I'll give only just a couple of examples because, again, we don't have time to elaborate on all healthcare systems. But first of all, you remember Loma Linda's part of their mission statement is to make man whole. So they, for a while, had this understanding of not just whole person care, but understanding that the entire world is an opportunity for us in the United States to contribute to wholeness and to hope and healing. So, for instance, Loma Linda, with their association with, and I think they even founded Adventist Health International, where you have a number of partnerships around the world. Then you think about Advent Health. So before Advent Health was Advent Health, in previous iterations of the healthcare system, they created something called Creation Health. What a wonderful focus on sort of the 8 principles of holistic living. And they have tried to take those 8 principles and sort of have them live within their delivery of care models as much as they were available to the general community to study, learn, understand. I remember long time ago, we bought the big kit, the Creation Health kit that came with how
I've
you
seen
can,
one of those,
remember, you can take your local church through, how to live healthy lifestyles, right? So, for instance, at Adventist HealthCare, I'll give you this example. We call them the continuum of care. The continuum of care is what services for healthcare you provide. Part of our continuum of care is education. So when we talk about ministering to the whole person or holistic care, we have one part of our continuum of care works with children who have developmental challenges. And so from early on, we provide those inflection points where parents can bring their children into this environment, and we actually run a school with a clinical staff that that interfaces with these children with significant developmental problems early. And we are seeing some remarkable outcomes where had we caught them 5 or 10 years later, it probably would have been too late, right? So all of our 5 healthcare systems in one way or the other, Adventist Health, for instance, on the West Coast, their affiliation with the Blue Zones Project. So this is the recent past that we hope to build on the future. And again, not speaking for all 5 systems, but I'm giving you examples from what I know, my line of sight, to my colleagues and what they're doing at the 5 healthcare systems. All of us are again doubling down on your question. How do we create a whole person approach to healthcare, which has been not just our brand, but our identity from those early days in Battle Creek, Michigan, and St. Helena and Washington Adventist Hospital in D.C. Or Tacoma Park. All the way from those early days until now, we've been trying to figure out how do we combine really advanced evidence-based care, such as the amazing miracle that we call an MRI, being able to see exactly what's happening in your body so that the physicians know what course of action to prescribe, with our whole person approach, our understanding that spiritual care must be baked into, must be infused into your care pathway, because it's not just the medicines, it's not just the quality of the hospital room, it's also the quality of how we see you as a person, right? The spiritual side of a person needs healing, as Jesus demonstrated many times through his ministry, as much as the physical side of the person needs healing. And again, all 5 healthcare systems have those glasses on. In other words, we attempt in various ways to try to live out of that identity.
Sometimes what the person needs is not just better medicine. They need to forgive someone. They need to restore the relationship with their parents or their children. Or it's, as you were describing this, Costin, what came to my mind is, what kind of health system would invest a lot of money in a package to try and train the communities to never or to need hospitals less and less?
Sure. Yeah.
The money that they have comes from caring for the patient. Then they take that money and they spend on it so that they have less patients. Commercially, it makes no sense.
Right.
But the values that you alluded to earlier demand that we try our best to keep people as far out of hospitals as possible. But when they do need it, we're there to help them. But health and wholeness is something that is proclaimed constantly. There's also a connection with diety and food, which medicine has not focused on for many years. I'm talking about traditional medicine. Right. It would be common for a doctor, after even 15 years of study, going through all of it, to have only 2 weeks of study of food, the impact between food and health. Now much more has been written about it, much more has been talked about it. But again, we were pioneers of that a long time ago. So there are many ways Adventist health, beyond the healthcare systems, Adventist health, so the calling to be healthier in every aspect of our lives, is at the foundation of every healthcare system now. When things go wrong, we need people that are very competent that will bring us back to health as fast as possible.
Absolutely. And you think of, by the way, Loma Linda University Health, that trains a lot of the physicians that end up not just at Loma Linda, but across our healthcare systems. So
I've interviewed some of them. They spend a lot of money paying for their studies. And their dream is to go and work in parts of the world that have no healthcare. They want to get in a plane and travel for an hour to get to an island that no one goes to care for the people that are in that island. And you see, as the more they talk about it, the more emotional they get, is their whole life is dedicated to helping others, which does not follow generally the study of medicine. You have lots of parents who dream of their children being doctors so that they can have enough money and sustainability and status and so on. So you find that in our universities, in my case, I have experience with Loma Linda, people that we interviewed here in this podcast that dream of being able to serve despite no status, because what's the status of being in the middle of the jungle? The financial incentives are also very much inverted. but healing is what they want to bring. Now, of course, we're telling stories that are inspiring and that we'd like to highlight because they match the values that we have. There are also stories that are not great, because as soon as you put people together to serve others, sometimes they have experiences that don't match the values of that location. I'm sure you have that as well within the hospital systems.
Yeah, I mean, ultimately, we understand as Seventh-day Adventist HealthCare systems that we exist in the world, right? In other words, there are plenty of opportunities where they are opportunities, but plenty of moments where our value system may not match that of, let's say, a patient or even a physician. And again, this is where it becomes really important to be able to live according to the values, right? So at Adventist HealthCare, we call them RISE's values: respect, integrity, service, excellence, stewardship. Those are RISE's values. We're always saying, did you comport yourself according to our RISE's value? We keep ourselves accountable to that. And so in those moments of mismatch, right, we live according, or we behave according to our RISE values, but we might have to have a difficult conversation sometimes and part ways, potentially with a team member that might not be representing the mission of our healthcare system well into the community. So again, yes, there are misalignments, but again, our calling is always to behave according to the values that Jesus exemplified when he served.
Which is the case for any organization on the planet. What the leaders dream of is not always what matches the end of care service at the end. Costin, any final word you would like our viewers to know about the healthcare systems, or in particular yours, or any final word you would like to bring?
Yeah, I certainly would invite listeners to consider joining the ministry of healthcare, right? In other words, any Seventh-day Adventist HealthCare organization around the world or in the United States is a place where you will feel at home, working to serve people in the same way that Jesus did. And my experience, again, transitioning from working with the world headquarters then to healthcare, is I just literally switched from one type of ministry to another type of ministry. And that's my invitation. My invitation is for anyone who is not just a caregiver, so I say a bedside caregiver, a provider, but also if you want to work in human resources or public relations and marketing or finance. Our healthcare systems offer you a place, or offer them a place where they can feel as if they are contributing to a ministry with outcomes that were modeled by Jesus 2,000 years ago.
Costin, thank you for joining us at A&N In Depth.
Thank you so much, Sam, for having me.
And thank you for listening to another episode of A&N In Depth. Tomorrow we'll be back right here from St. Louis at the 62nd General Conference session with another guest that will help you understand a little bit more about the inner workings of the Seventh-day Adventist Church.